I have seen maybe 5 emergency purchase orders in my career. We have did probably 500 emergency purchase orders to service the needs of COVID.
To put that in perspective, Ms. Wanda Matthews has been with the department for 40 years.
Harvey, Ike, Katrina, and those were emergencies that we had to respond to, but it's something that only is in effect for a couple days, weeks, maybe a month or so, and then things are back to normal.
I think we can all agree the COVID-19 pandemic was and is completely different.
When the pandemic came, everything needed to move much faster. Everything was something that was needed now.
That everybody has an emergency, and sometimes you can't move fast enough.
The contracts and procurement teams switched into high gear. This was a public health emergency and our response depended on it.
The biggest thing was finding vendors who could provide us with what we needed, because there was a run on supplies. First of all, finding vendors who were even open to provide us with what we needed.
There were new things that we needed to procure, PPEs and services and COVID testing and all that. So that created a whole new realm of issues for us.
Searching for PPE was the top priority.
Just finding vendors that could also handle the quantity of the things that we needed, because we didn't need 5 gloves or 5 boxes of gloves. I needed 5,000 boxes of gloves, and I need them yesterday.
Procurement specialist Robert Valendia recalls the unprecedented situation.
We didn't have gloves, we didn't have band-aids, we didn't have basic medical supplies. We didn't have personal protection equipment like gloves and gowns and face masks. We didn't have any of that.
It seemed like mission impossible.
No many of the things were available. We had to call different vendors. We had to work.
Contract administrator for COVID response, Tracy Ransom, joined the team at the start of the pandemic. It was fast-paced from day one.
I mean, it could take a day. Everybody does what they can to make it all happen and get together as smoothly, and sometimes it is literally a team effort, and we're literally running up and down the hallway, signing papers, scanning papers, emailing documents to get it done.
Shanthania Edwards provides contract services for Human Services, which includes the Area Agency on Aging. When the multi-service center shut down due to COVID, it created a crisis for Houston senior citizens.
That's where our older adults would go and have their meals, usually around lunchtime. So at that point, when they were asking everybody to stay home, especially our older adults, they still needed the food. Some of our contractors did not have any types of transportation or not enough transportation. So we had to come up with courier services to get food to our older adults.
The division also provides meals to adolescents in their programs.
We were able to have food drop shipped to their homes.
More than food, they also found ways to protect the vulnerable population from the virus.
And for the in-home testing, we had to find contractors that were willing to do that, organizations that, had people that could go out and do the vaccinations. We also did people with disabilities as well and their caregivers.
Wanda Matthews has seen a lot in her 4 decades with HHD, and she says the COVID-19 response just reaffirmed what she already knew.
Look at our track record. We have emergencies on a regular basis, unfortunately, but we always rise to the occasion.
For the Houston Health Department, I'm Morgan Nash.